Front-side headache, treatment and prevention. A headache that causes pain in the forehead is often due to tension, eye strain, or sinus problems. To prevent forehead headaches, people can try managing stress, maintaining good posture, and staying hydrated. A headache at the front of the head is rarely related to that part of the brain, and it is not a condition in itself. Pain in the forehead usually indicates one of several types of headaches. According to the National Institutes of Health, more than 9 in 10 adults will experience a headache at some point during their lifetime. Headaches are among the most common reasons for consulting a doctor or missing work or school. Tension headache. People can often relieve pain from tension headaches by taking over-the-counter pain relievers such as ibuprofen, acetaminophen, or aspirin. The following may also be helpful: having a massage, exercising the neck gently, taking a hot shower, placing a hot towel or washcloth on the forehead or neck. It is important to seek medical care for severe or persistent headaches and for those that occur more than 15 times a month, which doctors consider chronic. A doctor may sometimes prescribe the antidepressant amitriptyline to treat chronic tension headaches. Eye strain. People with eye strain headaches should see an eye doctor for an eye test. If defective eyesight is the cause, a person may require glasses or contact lenses. People can also take certain steps to minimize eye strain. This include taking regular breaks from visually demanding tasks, practicing good posture when sitting at a desk, stretching the neck, arms and back regularly, using an anti-glare filter for computer screens. Cluster headaches. People can experience bouts of cluster headaches that go on for weeks or months, usually 4 to 12 weeks. These headaches tend to occur around the same time each day and often wake people up. The cause of cluster headaches is not well understood, but they may run in families. Alcohol, smoking, and exposure to strong-smelling chemicals can trigger attacks. People experiencing cluster headaches should speak with a doctor. Treatment options include sumatriptan, corticosteroids, oxygen therapy, lithium, verapamil, a calcium channel blocker medication, injections of local anesthetic into the back of the head. In some cases, a healthcare professional may recommend surgery to implant an electrical stimulation device in the side of the person's face. Sinus headaches, sinusitis. A person looking to relieve the associated congestion can use a saltwater solution to clear their nostrils or inhale steam from a bowl of hot water. The best way to manage sinusitis depends on the cause. Cold or the flu, a person can use over-the-counter nasal decongestants and pain relievers such as ibuprofen or acetaminophen. Bacterial infection, a doctor may prescribe an antibiotic. Allergy, a doctor may recommend an antihistamine. A healthcare professional might also provide a corticosteroid nasal spray to relieve swelling. In some cases, it may be necessary to refer a person with sinusitis to an ear, nose and throat specialist known as an ENT. Anyone who has sinusitis that persists for longer than a week or gets worse should speak with a healthcare professional. How to prevent headaches? Certain lifestyle practices can help prevent or reduce the frequency of headaches. This include getting enough sleep. A person should try to go to sleep and wake up at regular times and resist the urge to oversleep on the weekends. Most adults require at least 7 hours of sleep per night. Engaging in regular physical activity. Exercising several times a week can help reduce stress and improve or maintain physical fitness. The Centers for Disease Control and Prevention recommends adults get 150 minutes per week of moderate physical activity. This equates to around 30 minutes or 5 days per week. Improving posture. If poor posture is the cause of a person's headaches, they may benefit from sitting up straight and ensuring that the lower back is properly supported. It is best to avoid sitting in the same position for too long and to take regular breaks from sitting at desk and looking at screens. Moderating caffeine intake. Moderating caffeine intake. Although too much caffeine can cause headaches, quitting suddenly can also have this effect, particularly if a person has habitually consumed large amounts of caffeine. Drinking plenty of water. By taking care to stay hydrated throughout the day, people can avoid a dehydration headache. Avoiding frequent use of pain relievers. The overuse of medication to manage headaches, which usually means taking pain relievers on 10 or more days of the month, can cause headaches. A healthcare professional can offer advice on preventive treatment approaches. Common triggers for headaches include stress or anger, poor posture, perfume or other chemicals, air pressure and weather changes, medications, grinding the teeth, bright lights, some foods and drinks including cheese, sodas, processed meats and cold foods such as ice cream. Therapies and activities that aid in relaxation or help manage pain and stress may also help prevent headaches. This include biofeedback, muscle relaxation techniques, meditation and breathing exercises, applying heat, cognitive behavioral therapy for stress, massage, neck exercises, physical therapy, yoga. It may be a good idea to keep a headache diary to identify possible triggers.